es que el último número de la revista Time le dio carátula a un profesor y a 11 invitados más, los genios de la longevidad. En esa lista ya tuvimos el placer de hablar con el jefe de la investigación. Está la doctora Andrea Britta Maier. Ella es una doctora de la Universidad Nacional de Singapur y fundadora de la CHI Longevidad. Es una autoridad en la gerociencia, en la geromedicina de precisión. Time la escogió como una de las 12 investigadoras que están a la vanguardia de la longevidad. La doctora Maier es reconocida por su trabajo para abordar uno de los primeros problemas en este campo. Ana, pues es un placer saludarla a ella y todo lo que está pasando con este boom de la longevidad. La primera pregunta para la doctora Maier es si todo esto que leímos en la revista Time y todos estos avances y todos estos descubrimientos científicos, ¿qué tan lejos están de la realidad? ¿Están a la vuelta de la esquina? ¿Seguimos hablando en términos de experimentos a cuántos años? ¿O desde ya podemos comenzar a aplicar para seguir las instrucciones de estos genios de la longevidad? Y por favor, denle las gracias.
Dr. Maier, thank you very much for your time today at Caracol Radio.
Thank you for having me.
So based on what you have studied the most, which is the evidence of, how much truth there is in the promises we have seen about, delaying aging. We saw a lot of, the Time magazine cover, which you are part of. They have 12 leaders that have dedicated their lives to longevity. And we wonder, how far away are we really from this that we're seeing there, from being able to live longer and better lives?
I think we have proven already that we can live longer. We did that for the past decades because we are adding many more candles on the birthday cake every year in most of the countries. But most importantly is not so much how long we live, but how good we feel at this moment. So think about yourself. Do you feel empowered? Do you feel good? Do you have enough energy? Not only to plan the vacation, to rest, but especially to do your job and to be really present. And that's so nice that we can now really optimize the health of individuals, not only that they are living longer, but most importantly, that they are feeling better and that you have the energy in the day to actually to do the things you want to do.
Bueno, lo que nos responde es que vivir más realmente en la última década ya lo hemos logrado, porque alrededor del mundo y en diferentes países ya las personas le están agregando más velas a su pudín o a su torta o como le llamen. Entonces nos dice que no importa qué tan lejos viva una persona o qué tantos años viva, sino más bien cómo nos sentimos ahora. Eso es realmente el foco, porque uno debe pensar en uno mismo, si tiene energía, si se siente empoderado, si se siente bien. No se trata de que se sienta solo bien en las vacaciones cuando es el momento de descansar, sino en el día a día, en el trabajo, estar presente. Entonces el foco es optimizar la salud de los individuos, no realmente que vivan más, sino que se sientan mejor, tener la energía suficiente para hacer las actividades que deben hacer en el día y lo que uno requiera.
Doctora Maier, ¿cree que en el futuro el envejecimiento podrá tratarse como un factor de riesgo médico de la misma manera que hoy tratamos otros factores que favorecen enfermedades?
Sorry, I don't speak Spanish.
No.
I
I'm sorry. No, I was just trying to understand the question myself. So, do you think that in the future, aging could be treated as perhaps how you treat other risk factors, diseases? Like, for example, I don't know, smoking. Let's use that example. So if you smoke, you have more of a tendency of getting lung cancer. Do you think that with time, maybe we'll be able to treat aging the same way, in which there's certain things that we will avoid and that could be, proven that they're going to delay aging?
Yes, it's we can avoid smoking, and everybody should do that, because it's not only lung cancer but also more atherosclerosis. So your chance of hypertension, high blood pressure is higher. So don't stop and start smoking, please. But very nicely, we showed in the past 20 years that we understand the biology of aging, why we age much, much better. So imagine that you are looking in a mirror and you see the wrinkles occurring. And these wrinkles are nothing else than exposure to sun, of course, but especially to aging. And now we understand what's happening in our skin, what's happening in our organ systems, and why we have the age-related diseases which are occurring at the age of 50, 60, 70, and eventually the reason why we die. So we understand why we age. This is fantastic. And if we understand it, why shouldn't we do something about it? You can either avoid it, like smoking, but most importantly, why shouldn't we treat the processes of aging, which gives us more wrinkles and more risk to have cancer or dementia, as a sort of disease where we can, for example, give drugs or have good lifestyle interventions. And that is what we do. We are intervening in making you age slower, in their ways have the chance to be longer on Earth and to feel better now.
Pues nos responde que si podemos evitar fumar, lo hagamos, porque eso no solo desarrolla cáncer de pulmón, sino también otras enfermedades como la osteoporosis. Nos dice que afecta también la atención de las personas. Entonces, si fuman, paren o no lo hagan. Nos dice que en los últimos 20 años se ha entendido mucho mejor la biología de la edad, la biología de por qué envejecemos, por qué cuando nos vemos en el espejo empiezan a aparecer ciertas arrugas. Entonces esa exposición que tienen los seres humanos al momento de envejecer, lo que está pasando en nuestros órganos, en la piel, eso se entiende mejor, porque pues ciertas enfermedades asociadas al envejecimiento empiezan a aparecer a los 50, a los 60, a los 70 y luego nos morimos por ello. Entonces si entendemos el envejecimiento, lo cual es fantástico, ¿por qué no hacemos algo al respecto? Y eso es lo que están tratando de hacer. No se trata solo de evitar fumar, que por supuesto es evidentemente malo para la salud, sino también tratar ese proceso de envejecimiento que lleva a las arrugas, al cáncer, a la demencia. Entonces se pueden tomar drogas o se pueden hacer ciertas intervenciones que lo que hace es ralentizar ese envejecimiento y nos permite estar más tiempo en la tierra y también en el presente sentirnos mejor.
Ahora, ella se dedica justamente a la geronciencia, es decir, evaluar si lo que nos dicen que va a evitar que envejezcamos efectivamente funciona. ¿Qué tanto engañan a la gente con eso? ¿Qué tantos productos, qué tantos tratamientos están apareciendo por ahí diciendo, lo vamos a hacer más joven o lo vamos a hacer evitar que envejezca, y en realidad son engaños, son mentiras?
Based on the study that you have done about what is true and what is not true, to what extent do you feel that, or what percentage would you give of the things that we read and we're offered constantly, this is going to keep you younger, you'll look 20 years younger, is true? What percentage of everything that we're offered do you think at this point is really true?
That's a very difficult question. I really cannot answer, but the majority of what is being offered is not proven. Very often we are seeing claims on social media very often who says, yes, it's likely that it works because we understand how it works, but it doesn't mean that it actually works. So we have to make sure that we have the proof. Very often also we see claims, yes, mice or rats lived twice as long, but we are not yet. We are not mice and we are not rats and we are not animals where these interventions were tested. So be very, very careful with things where it's not being tested. And the majority, I would say, but I don't know that percentage, is, I would say, giving the thought, yes, it works, but it is actually not. And that reaches from supplements to certain therapeutics, even drugs, where we think, okay, it's plausible that it works, but it's really not.
Es una pregunta difícil de responder porque nos dice que la mayoría de cosas que nos ofrecen en redes sociales, por ejemplo, no se pueden probar. Entonces nos dan esa ilusión de que funcionen, pero no quiere decir realmente que vayan a funcionar. Y hay que asegurarse por eso de que eso que vayamos a tomar sea probado en ensayos clínicos. A veces dicen que ya lo probaron en ratones o en ratas o en animales que viven el doble, pero nosotros no somos ratas ni animales. Entonces hay que estar seguros de que eso haya sido probado en humanos y hay que tener mucho cuidado con eso. La mayoría de las cosas que nos ofrecen en redes sociales no sabe el porcentaje exacto. Ella diría que no funcionan, que nos pueden dar la idea de que funcionan y realmente no. Y ella se refiere a suplementos, a terapias, a ciertas drogas que creemos o nos hacen creer que podrían funcionar y realmente no funcionan.
Pero en un mundo donde la población es cada vez más vieja, en que la natalidad es cada vez más baja y donde mucha gente tiene problemas para acceder a la salud en general a nivel global, ¿no termina siendo esto una posibilidad para ricos? Para los que tengan cómo pagar tratamientos costosos y darse ese lujo?
In a world where we're seeing, people are having less kids and, we have a world in which access to health is very scarce, is very limited. Wouldn't it be true that perhaps these programs that are being offered to live longer would only be available for the rich?
That's absolutely the case currently, but we do all efforts to change it. In the past 20 years, we understood better why we age. In the past 10 years, we understood better what kind of interventions we can do in humans. And in the past 5 years, we really understood better if we can bring it into clinical practice. So bring it into not only in the world of consumers, but especially bring it into clinical practice to teach the GP and the family doctor to say, okay, maybe we can prevent in age-related disease. So the healthy longevity medicine is very new and it's not established worldwide currently. We have a couple of clinics worldwide who are really making sure that evidence-based medicine is being provided. And that's the basis to grow this field even better. It has not been yet established worldwide into hospital systems, and especially in the public services, it's not yet integrated. So that really needs to happen in the next coming years, in the next decade, to really make it available for everybody and to democratize it, to really see it as an adventure where, imagine, maybe some listeners know when we had our first mobile phones, they were thick and they were clumsy. And from having a mobile phone, and it was quite for the ones who had financial means, now everybody has a mobile phone. And this is also what you're going to see in these new services in healthy longevity medicine, that is being democratized and that it will be available for everybody, because in the end, nobody wants to be sick. It's not about living longer, but it's about being healthier now, to also not only to feel better, but to be more productive. So in the end, also from a societal level, there will be lots of return of investment for governments to invest actually in health of humans.
Bueno, ella nos responde que ese esfuerzo hay que cambiarlo para que se pueda democratizar y funcione para todos. Entonces nos cuenta el proceso científico de cómo ha avanzado esto. Primero se trató de entender mejor por qué envejecemos, luego qué intervenciones se podían hacer en los humanos, y en los últimos 5 años se ha entendido mejor si podemos pasar esto a la práctica o a los ensayos clínicos, es decir, que los doctores lo puedan empezar a implementar y enseñárselo. Entonces nos dice que no es solo en el mundo de los consumidores como se realizaba antes, sino ya llevarlo a la práctica clínica y que los doctores puedan entender tal vez qué enfermedades por el envejecimiento relacionadas con el envejecimiento se pueden prevenir. Y nos dice que esto es bastante nuevo, esto no está todavía establecido en el mundo. Tienen las bases, pero hay que hacer crecer el campo mucho mejor. No se ha establecido en los sistemas de los hospitales, en el servicio público, no está completamente integrado. Entonces necesitan pasar años y décadas para hacerlo disponible para todos, para poder democratizarlo, para hacerlo funcionar mucho mejor. Eso no los compara con el celular. Al comienzo el celular no lo tenían todos, funcionaba mal, y ahora todos tenemos un celular y pues está mucho más democratizado, disponible para todos, y ella espera que eso es lo que vaya a pasar con este servicio para todas las personas, para que todos podamos vivir de una manera más saludable, para evitar estas enfermedades y sentirse mejor, estar mucho más productivo, lo cual puede tener un retorno económico también para las sociedades.
Ana, y ahora viene una pregunta un poco personal, por la que anticipo una disculpa si le molesta. Aquí entrevistamos de la misma lista de genios al doctor Nir Barzilai, un doctor del Instituto de Medicina de Israel. Y le preguntamos algo un poquito atrevido. En su mesa de noche, ¿qué frascos hay? ¿Qué pastillas está tomando? Y el doctor Barzilai dijo, yo tomo Rejuvant y tomo metformina y me ha ido muy bien. Tenía el pelo negro, el pelo blanco, y ahora lo volví a tener negro. Pregunta concreta para la doctora. Así como Barzilai toma Rejuvant y metformina, ¿ella qué toma cada noche?
Well, at the beginning of the week, we also interviewed Dr. Nir Barzilai. He's also one of the 12 leaders that Time has in their longevity edition. And he told us that he is taking two supplements. Well, he's taking two things for aging, we could say it that way. Rejuvant and metformina. He said that he has seen some changes, like, for example, his hair was white and now it's back to black. And with, a sense of audacity from us, we were wondering, what are you taking? Do you take any type of supplements or medicine for aging that you can share with us?
Yes, sorry that I laughed a little bit. I know Professor Nir Barzilai very well. It's a very good friend, but I haven't yet discovered his black hair. So metformin and Rejuvant, that's alpha ketoglutarate, are very good things. Very importantly is to take supplements or drugs which you need. And that really depends on if you are a female or a male, at what age you are, and what really your need is, how much you walk, for example, how much exercise you do. So whatever advice you get from others, please keep in mind that you should talk to your GP. I can tell you that I still have a little bit of gray hair, so I would love to have the supplements and drugs making me black again or brown. But I do not, currently, I don't take anything because I took prebiotics, for example, to make my gut health much, much better. And now I'm winding it off and I see how I do without supplements or drugs. But most importantly, I'm taking especially supplements when I need it, when my body is at need for it. And that is most important for the new arena of medicine, of healthy longevity medicine, that we should first measure what the need is of the body and then take something, and then evaluating if the success is there.
So, doctor, you don't take those supplements?
No. And metformin, I'm not old enough to take metformin. It's not so good for younger individuals. I give you examples. So all these kind of supplements and drugs, you need to really understand. That's the reason why we make medicine out of it. So we are prescribing it in clinical care. So you need an indication. Alpha-ketoglutarate, for example, is also not one. I took for a couple of months nicotinamide mononucleotide, MNN, for example, but I only take these kind of supplements when I can measure that my body is actually needing it. So the first thing I would advise everybody, get to know yourself. Not starting with supplements you can buy on whatever website for lots of money, but get to know yourself. And then, while knowing your genetics and having a good physician who talks you through, who really understands that next to the genetics, also the microbiome, your energy, how much you actually have, to then decide what do you need when. And I can tell you, there is a huge emphasis you can take with very good diet. So you haven't asked me that. And specific exercises to bring your energy levels up. And not only the energy levels, but for example, for male testosterone, you can bring up just with lifestyle intervention if you know what you should do.
I would love to have...
I'm very sorry.
Yeah, I was asking that because I would love to have the color of your eyes.
My eyes, okay, you don't see them now, but yes, they are greenish and blue, and luckily not gray yet.
No, very, very green and blue. Thank you, Doctor, where are you from?
I am originally German, but I'm calling in from the Netherlands at the moment. We just did a very long beach walk with my dog. He is now sleeping, so that's good. And I had my physical exercise. So whatever you do in terms of longevity, enjoy every step in your life. Not only that you have to take a step, but do it meaningfully and have some jokes and some fun and laughter with it. And that's half of the supplements you should take.
And for how long do you walk every day?
Roughly 1 or 2 hours. So really try to get your 8,000, 10,000 steps. But don't forget, you can do a little bit less, but not less than 7,000. But do your weightlifting, do your balance training. So really make sure that your beautiful body has lots of muscle, because these muscles are bringing the hormones into your brain, into your gut, into everywhere. Most important. And then feed your gut well and really looking at your diet. And that's half of the recipe. Just 7,000 to 10,000 steps. Do your weightlifting. Don't forget the balance training. Of course, sleep super well and care for your gut in a way that you really feel good. You don't feel sleepy after a meal, for example. You feel energized after the exercise, and that's most important.
Doctor, thank you very much for your advices. I will follow them. Thank you.
Good.
And have a great time with your dog.
Thank you so much. Thank you so much. Lovely to speak to you. Bye-bye.
Bye-bye.